Welcome to the Authority File. I'm Bill Mickey, your host and the editorial director at Choice. As we enter the winter months of 2020, COVID-19 infections and deaths continue to rise. The containment response here in the States and across the globe, such as it was, clearly hasn't worked as well as we hoped. And as we approach the long-awaited arrival of the vaccine, any progress we've managed to make in containing the virus has actually reversed itself. We're in for a rough winter. Along the way, as researchers track the data related to the spread of COVID-19, they've come to a new understanding of how policies, legal systems, and governance have responded to the virus, and how these have exposed vulnerabilities in our infrastructure, institutions, and most importantly, the people who are most susceptible to the virus and more likely to die from it. In fact, the manner in which many countries implemented their COVID-19 responses actually exacerbated vulnerabilities in certain populations. My guests for this series have compiled a volume that explores one country's response to COVID-19, Canada's. It's written primarily from a legal perspective, but grounded in governance, accountability, civil liberties, equity, labor, and global health. The book is called Vulnerable: The Law, Policy, and Ethics of COVID-19, published by the University of Ottawa Press, the sponsor of this series. While the title focuses on Canada's response to COVID-19, it includes a global perspective on the ways in which governments can and should prioritize their policies in responding to and recovering from a pandemic, pulling together experts in law, ethics, philosophy, public health, and medicine. Joining me are the book's editors. Colleen Flood is the University of Ottawa Research Chair in Health Law and Policy and inaugural Director of the Ottawa Centre for Health Law, Policy, and Ethics. Vanessa McDonald is Associate Professor at the University of Ottawa Faculty of Law and Co-Director of the U-Ottawa Public Law Centre. The Honourable Jane Philpott, who is Professor of Family Medicine, Dean of the Faculty of Health Sciences, and Director of the School of Medicine at Queen's University in Kingston, Ontario, and served as Canada's Minister of Health from 2015 to 2017, and then Minister of Indigenous Services from 2017 to 2019. Sophie Thériault is full professor and vice dean in the Faculty of Law at the University of Ottawa, and Sridhar Venkatapuram is an academic practitioner in global health ethics and justice. He is associate professor at King's College London and director of global health education and training at the King's Global Health Institute. Since we were fortunate enough to speak to the whole team of editors for this series, we're dividing the group among the 4 episodes. In the first 2 episodes, we hear from Colleen Flood and Vanessa McDonald, who examine the pandemic response from governmental and legal perspectives. In episodes 3 and 4, we'll be joined by Jane, Sophie, and Sridhar, who will address issues of equity and vulnerability. This is episode 2 of the series. If you've missed episode 1, feel free to go back and listen to it, and then pick up the conversation here. Once again, here are Colleen and Vanessa. So, Vanessa, in the chapter you wrote to address the topic of accountability, particularly at the executive and legislative levels, the pandemic has posed some unique challenges, the most significant of which is the ability of the executive and legislature to expand certain authorities and then provide legislative checks and balances when the government and courts themselves are essentially prevented from gathering face to face. What happened earlier this year when various governmental sectors basically shut down? How did this prevent or slow down the government's response to the pandemic?
Yeah, so one of the things that I talk about in the chapter is how even by emergency standards, this was a very challenging type of emergency for the government. In that literally it was unsafe for parliamentarians to gather. It was unsafe for courts to be physically open. And these are institutions, particularly the courts that are really organized around those face-to-face meetings. And, I think in recent years, parliamentary committee hearings, for example, it's not unusual to have individuals who appear remotely before committee, for example. But most of our institutions are still based around the model of meeting in person. And so
Hmm.
when all of a sudden that became impossible, and, I think the other thing to recall is I think now we have a somewhat better sense of what the risk is, and how to mitigate the risk when it comes to being in a public place in person. But at the early, in the beginning stages of the pandemic, we really had no idea how COVID was transmitted. And so, really, there was essentially a hard shutdown.
Hmm.
Lots of institutions to face contact, and you'll have certainly like judges, the judges in administrative roles in the province of Ontario, for example, would tell you, and did say, well, the courts here never closed. The courts were always open, and while technically that's probably true, what you had was overnight a situation where it was, the courts were forced to, and Parliament, to pivot to meeting online. And I think that was probably a somewhat easier for Parliament and for the provincial legislatures than it was for the courts. Our courts really were not digital, and it's been remarkable how in the last sort of now 9 months, how far the courts have gone to be able to resume their operations, largely online, sometimes in person where needed, but a lot, most of that service has been restored. But you can imagine if you have, especially for the courts, if you have no infrastructure for that, if you are not in the habit, many of our courts are not even in the habit of receiving documents electronically. In the early days, you still had to have, and you still have, a court clerk who had to be physically in the courtroom with the documents, even if everyone else was remote. This was still largely a paper-based system. And so, even by emergency standards, just keeping the institutions of government operating was a huge challenge. And a lot of progress has been made. I think there's no question about that. But I think many people would also be surprised at how many court cases are still not proceeding.
Hmm.
And certainly in the criminal sphere, you cannot force an accused to proceed by through a virtual hearing, and there are lots of circumstances where an in-person hearing is, it's still difficult to schedule. So yeah, our institutions are still facing real challenges in this regard, particularly the courts, I would say now. um, I think the legislature has had a bit of a leg up in terms of already having some of this infrastructure.
Yeah. So at this point, would you say, Vanessa, that just specifically in terms of addressing the pandemic, that the system is moving better and more quickly?
Yeah, I think there's no question now that
Yeah.
if and when Parliament needs to meet, when committees need to meet, they're meeting.
Hmm.
And that's happening federally, that's happening provincially. I think now we have good systems in place. I also think as I mentioned, we also have a number of good risk mitigation strategies now, right? We know more about how COVID is transmitted. We know the value of masks. I mean, it's hard to believe now, 9 months later, that we went for a period of months with certainly our federal public health officials saying masks weren't necessary. And now really masks are so essential to the resumption of daily activities in this country. Like, it's why kids are still in school. It's why businesses are open, because of
Hmm.
masking, um, hand washing, all of those other good habits, a focus on good ventilation. So we just know a lot more as well about how to mitigate risk. And so there are, like most courtrooms across Canada have been retrofitted with plexiglass shields, with social distancing. So some matters are proceeding now that weren't before. And So I think that's also, we've retrofitted public spaces to allow various kinds of gathering, and that obviously includes courts, and that includes the legislatures. There's less, public galleries are still closed, for example, but the public can still call in. So even that sort of public dimension of the justice system, of the legislative process, that has also been facilitated largely remotely, but the institutions have found a way to make it work. And I would just say, there are some, I'll give you just one example, like the Federal Court of Canada, they have a limited jurisdiction. They hear certain federal matters. So they hear judicial reviews, they hear immigration matters, they hear national security matters, and other related matters. They were well on their way as a court to moving some of their proceedings online because of the types of matters that the federal court hears. It's not like a criminal trial where you're hearing a bunch of in-person witnesses. Like a lot of their proceedings, it's just the lawyers who are there arguing. And so they had already been sort of well on their way toward thinking about how they could go digital. And so the pandemic sort of forced them to act more quickly. The Chief Justice of the Federal Court, Paul Crampton, has said that publicly, that this caused the federal court to move more quickly in the direction of becoming digital. But, they had already started down that path, and their matters are well suited to that kind of thing. And so they really moved quite easily. Whereas other courts, like the courts that are hearing criminal trials where you have witnesses, where credibility is always a central thing that a judge is trying to evaluate. In those courtrooms, it's just practically much more challenging to move those kinds of matters online. So I think it's also important to acknowledge that that process of reacting has not been uniform, that some courts were further along to begin with. And then, some courts hear matters that are more easily moved online than others, where, it's just challenging when you have an accused who has lots of constitutional rights that need to be respected. You can't just decide you're going to hold his criminal trial on Zoom. It's
right.
That's not on. So
Okay. Colleen, in a previous call, you mentioned how public health reform isn't always addressed preemptively or proactively. So I do want to address the issue of preparedness. And so it's usually something that's addressed after the damage is already done. Canada has had the unique experience with past pandemics like SARS and H1N1. Well, both of these events led to reforms in Canadian public health response. Many of the chapters in the book explore how it wasn't enough to prepare for COVID. For example, communication problems between federal and provincial governments, like we've discussed, and effects that go beyond healthcare into social and economic problems. Why were previous reforms not able to better equip Canada for the current pandemic? And in general, why isn't public health reform more popular, so to speak?
So let's start with the last part first. So
okay.
Public health, population health. So here we're not talking about health care. We're talking about infectious disease, sexually transmitted disease, the social determinants of health, like housing and so forth. So this is, the realm of public health. Anti-tobacco, cessation, all of these good things.
Right.
Now, the problem with public health is that it's just not as immediate as investments in healthcare. So a government invests in healthcare, they open up a wing of a hospital, they hire, 300 new nurses, et cetera, et cetera. So there are immediate political payoffs for investing in healthcare. It's much harder to make, the political case for investing in public health because it's at best, long term. And if you've done a good job in investing in public health, people don't even know that they should be thanking you. So if the pandemic doesn't impact you, you don't see, a widespread outbreak of an infectious disease because of precautionary measures taken, you don't know that you should be grateful, right? So there's a basic kind of political dynamic problem with investment in public health. And what you tend to see, and this is what happened in Canada after SARS and H1N1, a flurry of interest and activity, more money put into public health, but that over time it wanes away as interest and attention, political attention, is diverted elsewhere. So, there may be some means going forward that we need to figure out that we, kind of lash ourselves like Sisyphus to the mast and require that some percentage of whatever we spend on healthcare or percentage of GDP go to public health preparedness, so that next time round we are better. We have had the investments that we need, and those are critical investments in things like surveillance and in data collection, and so being able to respond really adroitly and well in the moment means that in that moment, right at the very beginning, you're able to get the data that you need. It's able to be communicated around to all the various players, and everyone has the best possible knowledge that they can to make the best possible set of decisions. So why wasn't Canada better prepared? Well, we don't know the counterfactual, so it could have been way worse than what
True.
what
Yes.
we currently are experiencing. And I think it probably would have been. I think, that SARS did give us a warm up. It did give us a
Yeah.
horrible shock. And so there was a lot more work done to create, for example, a public health agency for all of Canada. Now, at the time after SARS, there was really a big question for the federal government at that point, which was to go for more of a command and control approach, to basically pass legislation that would enable the federal government to act unilaterally in the context of a pandemic. More of a militaristic kind of response if it was needed, or whether it would go for what we call here cooperative federalism. So, we'll all hold hands, federal and provincial governments work together, and that being the great vision of Canada. And so they opted for the latter. They opted for cooperative federalism, the idea that federal and provincial governments would work together to prepare for the next pandemic, to prepare for public health emergencies. And so, although that's a lovely vision, it hasn't panned out as well as it could have or should have. And so it remains, more of an ideal than, more of a political ideal than reality. And so we still just have enormous problems getting data flowing from local and provincial levels up to the federal government, from the federal government and around all the provinces. And so I think that, at the end of the day, we're going to have to come back once we've mastered COVID-19 and rethink this. So, at least in some situations, I think there is a need for more central control, if you want, in certain circumstances. And I think that needs to be provided for. We need to have the ability to have the data at a minimum. We need to have data, provided to all decision makers, and if someone is not willing to provide that, any level of government, then I think they have to be required to provide it. And I think that would be myself. I think that would be constitutionally permissible.
Right.
And so that's. I think that's why, that's the basic problem about public health, why we don't invest in it as much as we should. And then the second answer to your question, why perhaps we weren't as prepared as we should have been. It's interesting when you look at a place like Hong Kong, how much more better they were in response to COVID because of their own experiences with SARS and H1N1. And in particular, they had really taken on board this idea of masking. And, I find that interesting comparison to compare Canada to Hong Kong and wonder why they learnt the lessons that they did, and we seem to have learnt different lessons. So I'm still puzzling that one out.
Right. Vanessa, I do want to address accountability more specifically. And this is a tough one because who wants to be accountable, I suppose, in a situation like this? But I mean, a widespread public health crisis was not unexpected. Are there levels of I'm just curious, are there levels of accountability that can be kind of baked into legislation moving forward that establish some kind of benchmarks for various federal and or provincial responsibilities? How do we hold people accountable going forward?
Well, I mean, I guess there's sort of two answers to this. One is to say that our existing, like there are measures of accountability that are baked into our existing system, and there are like sort of multiple overlapping systems of accountability, and and so that includes like the legislative process itself, for example. So what happens at the committee stage, the ability of members of the opposition to challenge the government's position, to demand answers, to have experts appear at committee and provide their views on legislation. The courts are, of course, an important source of accountability. The challenge in the early days of the pandemic is as I pointed out, that everything had wound down sort of temporarily. It was very difficult to access those spaces. And so there's a lot more happening on that front now. And then, of course, part of what we do in the book is also try to identify the ways that other sources of accountability might also be effective sort of outside of the political process. So we do talk about the media. We have a chapter by a former Globe and Mail reporter, Jeffrey Simpson, about the role that the media has played. And one of the stories, I think, in Canada that will be talked about when this pandemic is over is the role of journalists. And one journalist in particular, Andre Picard, who is also a journalist at the Globe and Mail, who I think has really emerged as a voice, sort of the conscience, I would say, of Canadians in the context of this pandemic. And I think he's a health reporter, but he's written in these sort of key moments, I think, a number of really compelling op-eds urging the government to pay attention to things that it wasn't paying attention to, or to make hard decisions. And so there's no question that the media are playing an important role there. So we can always question, how effective those different accountability mechanisms are. And they're certainly not perfect, but they are operating now. I think it's fair to say in a decently robust manner. But then you of course have the point that Colleen makes so often, which is we did forget many of the lessons of SARS, right? And not only that, but we've already forgotten, it would seem, the lessons of the first wave. I mean, many of the things that we were horrified with, these deaths in long-term care homes in the first wave, we are literally seeing all over again. And we are in almost no better position. We have more PPE than we did in March. There's no question about that. But we are still battling horrific outbreaks. And so, part of the problem is that we do have a very short memory. And there is this question of whether, when we get beyond this, are we going to be willing to invest in those public goods in a proactive way that will keep us safe next time? We're just not very good at that sort of longer term thinking. Let's invest a lot, a bunch of resources now in case in 15 years we're faced with this again. This is not, both politicians and the broader public think more short term. It's going to be very difficult to convince people to invest in public health in a meaningful way unless they believe that another pandemic is literally around the corner, right? And we're just,
Right.
it's not how we think. So it's a challenge.
Yeah, and Colleen, you were touching on that earlier when you were talking about public health versus investment versus healthcare investment. But Colleen, I do want to touch on Chapter 2 of Section 1, which explores how First Nations used self-determination to develop responses
Yeah.
that avoid jurisdictional disputes and are better suited to their challenges as a vulnerable population during COVID. Can you
Yeah.
talk about the particular problems First Nations were dealing with pre-pandemic and how these were exacerbated when COVID struck, and what type of support has the federal government offered in response?
Right. So many of the precautions that we might think about, for example, lockdown, have a high impact, as Vanessa has mentioned, on some of the most vulnerable, and particularly those for whom's homes are not great places to be, because there's overcrowding, inadequate ventilation, in some cases in Indigenous populations, no clean running water. And this is true of a number of Indigenous locations for Indigenous peoples across Canada. Not all, but of course, but in much higher rates than other Canadians. So when we're asking people to self-isolate, to quarantine, or we're moving into even broader lockdowns, this can have a very negative effect on lower socioeconomic groups
Mm-hmm.
and Indigenous peoples living in these kinds of conditions. And in fact, arguably it can make it more dangerous for those groups than, not taking those precautions because they're in closer contact with others who might be infected. So it's basically a problem of poverty and housing conditions, and disproportionately Indigenous people wore that prior to COVID. So these problems are exacerbated with precautions that are taken. So the federal government, Indigenous peoples are within their constitutional jurisdiction. I know that the federal government has been very concerned and attentive to the issues of Indigenous people, and trying to channel a lot of funding towards them. So something like uh, 2.4 million, or billion, I'm sorry, in the first kind of tranche, and then just recently another 200 million. And so this involved things like providing supplies and PPE and
Mm-hmm.
clinics, and the last tranche of money is for things like improving schools and daycare so that these aren't conduits for the transmission of the infection. So basically, we've seen the federal government trying to, give money to the needs for Indigenous people. It's hard for me as an outsider to know, is this anywhere near enough to deal with the issues that Indigenous peoples have? But certainly, the federal government has been providing that funding.
Okay.
Yeah, so then the other issue that you've seen is Indigenous peoples themselves, through Indigenous self-government, saying, just as provinces and others are taking jurisdiction, that they too will take jurisdiction vis-a-vis their own people, and predominantly doing things like closing borders, so only letting their own people in and out of their communities to try to reduce the spread of the infection, and in some cases actually setting up their own public health infrastructure for contact testing and tracing,
Mm-hmm.
try to making all these things more culturally appropriate. So, on the one hand, I said before, I'd rather see more, top down command and control. We need to have more clear kind of rules. But with this, I think it is so different that Indigenous peoples have such different needs that it does make sense to me for Indigenous peoples to make their to make public health work for them and their own communities and their own particular needs.
Right. And manage that themselves.
Yeah.
I want to kind of do a little speculating if you'll both kind of indulge me. And I'm wondering, given what we've just talked about, would you care to speculate on how a vaccine will be distributed? Has there been any sort of discussion around a federally driven distribution system?
Yeah.
Or a provincial approach, or a combination of the two?
Well, I think that I'll let Vanessa jump in whenever she wants, but with H1N1, it was really left to the provinces to do the distribution.
Mm-hmm.
So we'll have to see. I don't think that there's been much said about that so far, but the federal government is procuring the vaccine
Right.
and has assiduously entered into a variety of contracts with pharmaceutical developers. So it seems like Canada will, be getting the necessary vaccines from Pfizer and others that have, just been announced as imminent. So that is all good. But then, how will they be distributed? I heard that even with the procurement contracts that we have, with the initial delivery, there'd be something like 1.1 million vaccinations available. So decisions will have to be made about who, and presumably that is going to be left again to the federal government. One will assume it will be, focused on healthcare workers and the most vulnerable. So people in long-term care homes or with different kinds of conditions that might make them particularly susceptible to COVID or death from COVID. So there'll be those kinds of ways that it is distributed, but I think there are a bunch of interesting issues here. So, for example, will either the federal or provincial governments try to mandate healthcare workers or the residents of long-term care homes have the vaccine?
Mm-hmm.
Then we get back to this question of civil liberties, civil rights that we raised before. So,
yeah.
That's a different question from, can I get it, but are you going to make me have it? There's another whole kettle of fish, right?
Right. Vanessa, anything you want to add to that, or?
No, I mean, just to say that, the way that it has proceeded in Canada has been that the federal government has taken charge of the procurement of vaccines for the country and negotiating those contracts, and that, things will trickle down from there. But certainly the rollout of a vaccination program is going to happen at the provincial level. And as Colleen has identified, of course, there will be, there are significant logistical challenges that are associated with that. And there are also, of course, very important value judgments about who should be at the front of the line when it comes to being vaccinated. But yeah, absolutely. I think, it will be interesting to see whether healthcare workers are mandated to receive the vaccine. You can also, of course, then imagine like private employers as well, right? It will not just be these frontline workers for whom vaccination will be very important, but you can imagine businesses who are keen on resuming normal activity, wanting to know that their workers have been vaccinated. So it will also be interesting to watch from a sort of labor and human rights perspective what the response will be from private enterprise when it comes to requiring that their employees, any attempts to require that employees be vaccinated.
Mm-hmm. Mm-hmm. Excellent. Okay, well, Colleen and Vanessa, that's all we have time for. Thank you so much for joining us on the program.
Oh, it was my pleasure. Thank you very much for asking us.
Thanks for having us.
All right. You just heard from Colleen Flood and Vanessa McDonald, co-editors of the book Vulnerable, The Law, Policy, and Ethics of COVID-19, published by the University of Ottawa Press, the sponsor of this series. Join us next week when I'll be joined by the other editors of the book when we'll discuss the issues of equity and vulnerability in Canada's response to the pandemic.
And the ones especially pertaining to the use of public spaces, to physical distancing, or the rules on isolation when they're enforced on some populations may be really inefficient. So for instance, trying to enforce public health directive pertaining to the use of or forbidding the use of certain public space on homeless people, for instance, or obligating people living in homelessness to isolate will not be very efficient and will actually risk to aggravate the marginalization and the oppression experienced by these individuals. So this is one concrete example that shows how we need to take into account the specific needs and circumstances that are specific to all the groups that are particularly vulnerable to COVID, in order for the measures to be efficient and uphold human dignities and human rights.
If you like what you hear, rate us or give us a review on your podcast platform of choice. And if there's a topic you'd like us to cover, drop me a line. I'm at bmickey@ala-choice.org. As always, sponsorship and advertising for the Authority File podcast are handled by Choice's advertising manager, Pam Marino, and all of our episodes are produced by Choice's senior digital media producer, Mark Dirks, and digital media assistant, Sabrina Kofer. That's all for this week. Thanks for joining us.